Young, thin, well-looking female patient is sitting on the bed having a pulse rate of 80 beats per minute. It is of normal rhythm, volume and character. Blood pressure is 110 by 70 millimeter of mercury. The JVP is not raised. There is no cyanosis, clubbing and pedal edema. On examination of the pericardium, there is no scar, bulging or deformity. The apex beat is undisplaced, lies in the fifth intercostal space, medial to the midclavicular line, and it is of normal character. There are no other heaves and thrills palpable. On auscultation, the first heart sound and second heart sound are normal. There is presence of a mid-systolic click which is followed by a late systolic crescendo, decrescendo murmur which is based here at the left lower sternal edge. The lung fields are clear to auscultation. There are no signs of the pulmonary hypertension. There is no stigmata of the infection.